I acknowledge the traditional owners of this country. As an Aboriginal man not from this country, I always pay my respects to the traditional owners. Thinking through what this place was before Melbourne was established, I think is important, and knowing that there's a vibrant, contemporary, cultural narrative that's woven through this place, I think is something that we should keep front of mind. But without any further delay, I'd like to welcome Auntie Di Kerr up here to give a traditional welcome to her country.
I would like to offer you my hand in friendship. I do that culturally so that we can walk together. May Bunjil, my Creator, surround you all and keep you safe on country. As part of my welcome, I ask you to make two promises: not to harm the land or the waterways of my country, and not to harm any of Bunjil's children. That's all we ask. In return of that, you're allowed to access any resources on my country until you leave. Womanjika, Wurundjeri Balak, Yumungundi Big. That means welcome to the home of Wurundjeri country. I wish to welcome you from the tops of the trees to the roots in the ground. So when we look after each other and we look after country, country truly looks after us. Nungodjan, thank you.
Thank you to Arnold Bloch-Liebler for hosting us today. The firm itself, I think, is a fine example of an old established Australian company working side by side and hand in hand with the Indigenous communities of Australia. So I'm very grateful. I'm just going to give you a little bit of a potted history about all of this, because the story of this study goes back about 10 years, when the United Nations Permanent Forum on Indigenous Issues made a call for action on Indigenous disadvantage around the world. The Lancet picked up that challenge and commissioned studies in 2006 and 2009, and Ian was involved in those early studies, which then followed up in 2013 when the Lancet, commissioned this work from the Lowitja Institute. As the chair of the Lowitja Institute, I'm very proud that a small Aboriginal and Torres Strait Islander organisation like us, at the bottom of the world, has been able to make this contribution to which is a unique and landmark study of the health and social status of Indigenous and tribal peoples from around the world. As an organisation, our purpose is to value health and well-being of Aboriginal and Torres Strait Islander people, but as members of a global Indigenous family, we extend our purpose to all Indigenous peoples of the world, our brothers and sisters, if you like. Work like this is very important to us if we are going to achieve the Sustainable Development Goals to end all forms of poverty, fight inequalities, and tackle climate change, and ensure that no one is left behind. We have to have the tools, the knowledge, the quality data to make good decisions about the ways forward. That can't happen without full engagement with Indigenous peoples wherever we live.
I think we started our conversation about a year ago or so, soon after I'd arrived at the Lowitja Institute, and it's been an absolute delight working with the Lancet. I reflected on the fact that we're standing here in Melbourne, and Melbourne was founded in it wasn't founded, I mean Aboriginal people have been here for thousands of generations, but in terms of the formal Melbourne city, 1835 was when Melbourne was established. And it struck me that the Lancet is older than Melbourne. The Lancet was established in 1823. So if you look at the collaboration, we have the Lancet, almost 200 years old, the Lowitja Institute, 5 years old, with that history back through the cooperative research centres.
Having gathered together about a few collaborators, potential collaborators from various countries around the world, and then decided we needed to expand, so Ian contacted some more people. The people we met in New York had contacts, and through word of mouth, we got together 23 countries, I'm not sure how many collaborators, about 60 65 collaborators. So this is a massive, massive effort. And the wish of the Lancet for the future is that this work should continue, that it should have some influence and improve the lot, the health of people around the world who are Indigenous, and that governments should take account of their Indigenous people.
Today, even notwithstanding this project, some of the most marginalised and poor Indigenous peoples across the world are absolutely statistically invisible. And so part of the driving force behind this project was to enable Indigenous peoples and tribal peoples across the globe to be visible, to actually understand the challenges that people face in terms of health outcomes and the challenges that people face in terms of social inequalities, to drive accountability. This is the most comprehensive study of its kind ever done. We have coverage of approximately 50% of the global population, 28 Indigenous populations across 23 countries. What it does tell us is that Indigenous and tribal people's health is a global issue. We won't get real change in global equality unless we actually focus on the health of Indigenous and tribal peoples. This is the first time that we have comprehensive data on the 104 million scheduled tribes people of India. It is the first time that a project of this kind actually has reach into China and many countries in Southeast Asia. In order for the global implications of this project to be realised, we need to recognise the leadership of Indigenous peoples globally and representative bodies. The United Nations has an important challenge in front of it. It drives a very ambitious agenda around sustainable development goals, but those goals won't be realised. They cannot be realised if we're actually not globally giving attention to that portion of our population which disproportionately share the global burden of poverty and ill health. It also means that we need to create the opportunities globally to learn from each other. One of the very enriching things that we've done over the last 15 years is to work with colleagues from Aotearoa, from across the Pacific, Canadian Aboriginal folks, and Native Americans. And that has really accelerated change and development because we're learning from each other about our success stories, often our failures, and we're sharing collegiately about building strategies for change. And this project says that we can do that, and more so we can do that with global scale. Governments also have a responsibility. They need to take action and recognising the pivotal role of Indigenous leadership, ensuring that Indigenous health is a priority, focusing on quality data, focusing on access to health services, and tackling the social inequalities that are fundamental to Indigenous health inequalities.
Being involved in this project has shown me is that Indigenous peoples of the world have so many different political contexts, histories, definitions of who's Indigenous. It's really been an eye-opener for me and a very precious experience. And it's made me appreciate the data systems that we have in Aotearoa, New Zealand, Australia, Canada, US, the countries that we usually work with. We have, but I've also been impressed with the contributions that our colleagues from India, from Pakistan, from Southeast Asia, from South America have been able to make as they've developed, researched their own data specifically for this project, or used the very impressive developing data systems in South America. The data sovereignty issue, I think that this project raises, Indigenous data sovereignty is a kind of a growing movement, and it's something I think that's, well, it's been evident in Indigenous research for a long time, of course. We've always had charge of our own data and our own information and knowledge bases. Now that it's becoming incorporated into government data sources, health surveillance systems. We need to take charge of what's happening to our own data. We have big data coming fast at us in our developed countries. In New Zealand, there's data matching going on between justice, health, education, welfare, and other databases that's being used to specifically target particular families for vulnerable children policy. So I think that the articles plea for partnership in our data development with Indigenous peoples is crucial. We've got that luxury of having big data to worry about. Other countries have got no data or very scarce data, sparse data. And so there's two ends of the spectrums working together here, and we very much appreciate the Lancet's commitment to Indigenous health and to bringing this all to light and helping us all advocate for improved health through the good use of Indigenous health data. Kia ora, thank you.
Ian, this is a magnificent effort. It's a huge effort. The most important thing is this global partnership of 65 people, and I hope that this, as you said, Steph, will be the first of many things, not just Lancet articles, but a whole lot of activities can stem from these 65 groups that you've got as part of this, and the Lowitja to have with Ian have pioneered this is fantastic. And I presume that things like, the United Nations and WHO could well take note of these findings in this report and start to do things like funding it and so on. So I hope very much that this is the beginning of a major international collaboration, because international studies are really important and they're very powerful. The pathways here are clear, even though they're not linked together. If you start off with poverty and poor education, you have low birth weight. You have then children who are underweight and then overweight and then can't get educated and then become poor. So you do have these cycles that are in these data very, very clearly. You can get so much out of these data, even though they're not linked and even though they're just looking at them as singular measures to be compared. And the stories aren't good. And they're not good for countries like Australia and New Zealand. They're not good. They're not good stories. We want these stories to be better. We don't want these cycles of deprivation that we really should have done something about time and time and time again. The reason that we have failed over multiple times to implement services that are effective for Aboriginal people is that we haven't got Aboriginal people running the show. Aboriginal people know what to do. They have the solutions, and it is really, really important that we give them that power. And I don't know why we don't. It just seems to me so self-evident. So it's with enormous honour and whatever humility and all the rest of it, for me to launch this incredible Lancet study, Indigenous and Tribal People's Health, the Lancet-Lowitja Institute Global Collaboration, a population study with by Ian Anderson, Bridget Robson, et al. And the et al. is just the longest list of wonderful people that you've managed to get together. Thank you very much.